Hi Anita, how are you today?
And then we make sure that we only bring in the resources that we need. And then we'll give you a little privacy, Anita. Then we'll do hand hygiene. And then we'll just double check her name in and everything and have her verbalize her 2 patient identifiers, which should be her name and her date of birth. Anita, I'm Nurse Danny.
I'm Nurse Lanae, and we're going to be giving you your bed bath today. Can I have you confirm your name and date of birth for me? Good.
Alright, Anita, we're going to use the bathroom, but first, before we do that, we make sure that the bed is always in the lowest position, that the wheels are locked.
And we're going to make sure that the bed alarm is off if they have to have it on.
Alright, and then if they have any O2 tubings, IV tubings, just make sure they're not stuck and our patient does not have any.
Okay.
Anita, we're going to put you on the bedpan now. And then also make sure that the side rails are up too, unless someone is standing here.
Okay, we're going to roll you towards Danny so that you can get this under you here.
And then make sure that the patient is covered at all times, just so they have privacy. And then I'm going to walk away, and then Lanae will stay here, and I'm going to go get the bath ready. While I was away, I did perform hand hygiene, and then I got the bath ready. And then we would put some soap in here, and then double check with the wrist the temperature. And then Anita, are you all finished going to the bathroom?
All right, we're going to roll you towards Danny again so I can take your bedpan out. And I'm going to go empty this, and when I get back, I'm going to perform hand hygiene so we can get the bath ready.
You want to just say how that you use the bedpan, just so they know which way you used it?
Okay, should we start?
Yeah. Well, no, we don't have to start over. You just yeah. Okay. All right. All right, Anita. And then we'll start by taking the comforter off.
While we're taking the comforter off, we want to make sure that before we remove the sheets that we keep the patient covered at all times. So we're going to use a bath blanket and then drape it over her and pull the sheet out from underneath of it.
You want to set this over here? And then we're just going to conserve that. All right, and then we do have our dirty laundry bin right here.
All right, Anita.
Then we'll take off the patient's gown, making sure that she's still completely covered.
And we're going to throw that in the dirty laundry bin as well. Okay.
All right, and then we'll take off the patient's head hose if they have any on. Then we can set those there and we'll reuse those. Alright. And then we'll raise the bed up so that we don't strain our backs.
Are you doing okay? always make sure to check the patient to make sure that they're doing okay and they're not having any pain or problems.
And then you can double check if, you can ask the patient if they're able to do things on their own or if they need help doing something. Anita, did you want assistance in your bath today, or did you want to do some parts by yourself? Right. And then she did say that she does need help doing her full bath because she still is pretty sick. Alright. And then we'll start by doing the eyes, and then we'll fold it into 4 like this. Alright. Then you start from cleaning the inside and wipe out. And then you fold it back so that you have a new clean area.
And this is the time where if your patient has oxygen, you would take it out and clean the pieces that the oxygen comes out and into the nose.
Yep. And then at the same time, you can just double check that the O2 is working, and then you check the meter on the wall as well.
Throughout the bed bath, it's important to also make sure that you don't roll her over onto the oxygen tube, because if the oxygen gets obstructed, or it could get ripped out of their nose too.
And then if they do have the O2, just make sure to check under the nose and behind the ears for any pressure points or redness.
And since the face isn't a terribly dirty spot, we don't have to change towels, but we do need to rinse in the water.
And then we'll move to the arms next.
While we do the arms, we just want to make sure that her arms are the only thing showing, to try to give the patient as much privacy as possible. When you do the bed bath, especially when you're doing the arms and the legs, you always want to make sure that you go from
distal to proximal, and that's to promote circulation.
And since the armpit is dirty, you want to make sure that you clean that last so that you can change your towel before you move on. And when you clean the hands, make sure you go between the fingers and get the palm and the wrist really good where the creases are.
And then we'll throw those in the dirty laundry bin.
And then when we're done with that, we can ask the patient if they want deodorant, since we just cleaned it. Anita, did you want some deodorant?
And the patient did verbalize yes. We will give her some. And then we'll just double check. We do want to dry the arms, but you don't want to sit there and rub. So you just want to sit there and then pat it dry.
This is just to avoid any tears in the skin. If they're an older patient, it does happen very easily.
And then we'll move on to the legs next, and we'll do the same thing. Same thing, we'll go from distal to proximal.
When you're cleaning the feet, make sure to clean between the toes as well. And while you're doing this, you can check the heels to make sure that there's no bed sores or any scabs or lesions or anything.
And then when that's done, you can do the same thing and pat the legs dry. And then at that time we are done with the towel, so we can put that in the dirty laundry. And then we can rinse our rags. And then next we're going to move on to the chest area. And I'll have Lanae do that one.
Okay, when you're washing, you just want to go make sure you get underneath the breast if they are a woman. And I mean, if they're a man and they have breasts too, just make sure you get underneath that because it's a very common place to get sores and very common to like rub.
And that also includes skin folds as well, if they are an obese patient or overweight. And then next we will perform front pericare, and then Lanae's going to do that as well, and then I'll do the back and the back pericare as well.
Okay.
And then every time one of us steps away, we just have to make sure someone else is standing here.
Okay. So when you're doing pericare, you want to make sure that you go front to back because it's very important. It can spread infection, or if they didn't get all the feces wiped from the patient, it could spread into the front. So you want to make sure you go outside to back and then peel it back since it's a dirty area. And then the same thing on the other side and peel it back and then do the front to back.
And then after that, we do get new water. Lanae, if you want to step away.
Okay, I'm stepping away.
And then since she did perform the pericare, she is going to perform hand hygiene and get new water since that is considered soiled water now. And then Anita, we are going to roll you over to Lanae's side. And then I'm going to wash your back and your bottom, okay?
All right, Anita, are you ready?
All right. And then when we are washing the back, we want to go in strokes. We go up and out, and that's to promote circulation as well. And then I'll rinse off my rag, and then Anita, we're gonna do your bottom now, and then the same thing, you want to wipe front to back just to prevent infection, and then we'll start on the outside and then move to the inner. And then that is soiled. And then since I just did back pericare, I will go wash my hands and then rinse the water out as well.
Are you doing okay, Anita? Good. Okay, and while she's gone, I'm going to get the stuff ready to brush your teeth and dentures, so we can do that when we get close to being done.
And then I did perform hand hygiene when I got back. And then before we do the mouth care, we can ask the patient if they want any lotion on their back, if they need a back massage at all. Anita, did you want any lotion or anything on your back? And then the patient did say yes, so then grab the lotion. All right. And then we're just going to roll you over towards Lanae. Ready? Alright. And then you can rub lotion and give a back massage. And then you don't need gloves for this unless for some reason the patient has an open wound or infection. It just kind of varies from patient to patient. Alright. And then, Anita, we're going to perform some oral hygiene on you now, okay? Do you need anything? And then when we do oral hygiene, we do want to make sure that the head of the bed is up to prevent any choking.
Okay, Anita, I'm gonna brush your teeth, okay? And you could just spin in this if you need to, alright?
And normally, since Lanae is here, I would walk away, and then I would go clean the dentures in the sink. But I'll show you that in a second.
Okay, go ahead and spin, Anita.
And then you can also have the patient rinse as well.
Okay. Go ahead and spit that out. Swish it around a little bit. Okay.
Then I'll stay here while Lanae, she can go perform hand hygiene. And then once she is back, then I can go to the bathroom and I'll show you how I'd rinse this. You would put like a rag down in the sink just to prevent any harm from the dentures. And then you just want to put a little bit of toothpaste on there. And then you're going to clean the inside. And then make sure to clean the teeth, making sure to get any debris or anything out. If it is nighttime, you can leave the dentures soaking. If not, you can ask the patient if they want them back in. Just make sure to get everything all clean off the dentures, and then when you're done, we'd perform hand hygiene. So then I will perform hand hygiene once I'm finished. Alright, Anita, we're going to go ahead and we're going to change your sheets, and then we will get your gown back on and get you all ready for bed.
Okay, so when we change the sheets, we're going to have to get the patient to one side or the other so that when we roll them, we can get the sheets as far under them as possible. Okay, Anita, we're going to get you as close to Danny as we can, okay? And then we're going to flip you on your side so that we can change your sheets for you, okay?
We will roll the patient this way, and then just pay special caution to if they have any tubing still.
Okay. So we want to make sure that they still have their pillow, but we're just going to make sure that we roll this all the way up as far as we can underneath them. Okay. Okay. And then when I put this new one on, I'm just going to make sure that it's hooked onto both sides of my mattress over on my side, and make sure that we don't shake the sheets because that has a chance to get like infection and anything that's in the air possibly, or just on it.
Okay, well, the bed sheet is not staying, but alright, and then at the same time you'd also put an absorbent pad down as well, and then they're either reusable or disposable, just depending on the facility.
And the one that was on here was disposable, so we're just gonna take it with the linens so that we can throw it away later, so we don't have to spread it on the new sheets. And I'm just going to fold that so she can kind of take it out and onto the other side when she gets a chance to.
Alright, Anita, we're going to roll you back this way. Roll the patient back this way. So then I can do this side of the sheets. Then you'll just make sure that this is rolled out and even. Alright, Anita, we're going to roll you back to the center. Good. Alright, good. Alright, and then we can put her down on.
Okay, next we're going to put the top sheet on, and we're not going to put the comforter on quite yet because it's kind of heavier, so then I don't want her to feel like she's has restricted movement when we try to move her to put her down on.
And same thing, just make sure that the patient is covered at all times.
Once the sheet is on the patient, we can go ahead and pull out the bath blanket.
And then that will go in the soiled linen as well. And then we'll change the pillowcase.
And again, putting the top sheet on, I'm going to make sure we don't shake it so that it doesn't get anything on it. Okay, when changing the pillowcase, I'm going to make sure that you don't shake the pillow into the pillowcase. So what you're going to do is you're going to put both hands in and turn it inside out, and then take the pillow you're going to put your hands back inside here and take the corners of the pillow and fold it over top.
That way it's not shaking.
And then pull it. Okay, Anita, we're going to lift you back up so we can put this back under your head. Okay.
And then we can put the patient's gown on now. And then at the same time, if they have any IV tubings, make sure they don't get caught, and you would normally use a staff gown in this case if they do have an IV tubing. And then if the patient does have TED hose, then we'll put those on at this time if this patient does. Okay, and then the way you can do that is you can turn them inside out so that it is easier to put on.
You always look for the square because that usually lines up on the heel. Okay, and after you put these on, you want to make sure that there's no wrinkles, because that is, especially in older patients, a place that it will cut into their skin and they can possibly get lesions or anything other of that sort.
And then you want to make sure that the toes, that they can pop them out like this if you need to check the toe area at all.
Okay, next we're going to put the same comforter back on, because since there was a sheet underneath of it, we're going to conserve the resources and use it another time.
And if it was soiled, you would just grab a new one.
Okay. And when making the bed, you'll make sure that you tuck the whole end underneath the mattress. And then on the corners, peel the top side up and kind of make a triangle right here. And then tuck under the remainder that's hanging down. This is just so that the patient doesn't feel restricted and that the top can move freely.
And you just want to make sure that it's not rubbing against their toes. Anita, does everything feel okay? Good. And then at the same time, you can still double check IV tubing, O2 tubing, making sure everything's okay.
And then before we leave the room, we're going to make sure that she's doing okay and she doesn't need anything else. Anita, do you need anything from us before we leave? We'll be back in a little bit to check on you, okay?
And then Lanae can go ahead and lower the bed position. And then we'll do all the safety checks before we leave as well. We'll make sure that the collet is by the patient on their dominant side if they do have a weak side. Anita, we're going to leave the call light right here for you. If you need anything, just pull it and then just have the patient verbalize what they need to do if they need to call you so that they are aware. And then make sure that the wheels are locked.
Make sure your bed alarm is on. Obviously, again, make sure before you leave that the side rails are up and that they're in the comfortable position that they want to be.
And then if they have the fall prevention mats, and then we will perform hand hygiene before we leave the room, and then make sure to declutter. And then you can pull the privacy screens back out as you leave.